Hey, I'm Josh Evers, and we're doing a list of nursing superstitions. Some of them you might have heard of, some of them you might have not have heard of, because that's how things work. You either have or haven't something. So let's get started. The first one is the frequent flyer name drop, or I guess it's also called Beetlejuicing. I've never heard that before, but that's when you're wanting to, you're mentioning somebody or telling a story about like a patient that's there all the time. And when you say their name, next thing you know, boom, they pop up on your census. I don't think I'm superstitious, but that's just real. As a home health nurse, I'll drive by somebody's house that I haven't seen in a while, and then boom, they pop up on my census. So I don't know how that works, but it works. Tying a knot in a bed sheet. Have you ever heard of this one? So apparently if somebody's, not doing too well, you don't think they're going to make it through the night, you tie a knot in the bed sheet and that will keep them alive until the next shift. Kind of messed up. So what do? You just keep going with a knot, like night shift ties a knot, day shift ties a knot, night shift ties a knot, and then whoever forgets. Okay, next one is one I've definitely never heard of, and that's called a new shoes hex. That is whenever you wear a new pair of shoes, you're inviting to get those shoes messed up. Somebody's going to step on your kicks, or going to get, some kind of body fluids on there. I wouldn't know about this because I'm pretty sure I'm wearing the same shoes that I got in, I think my shoes are from, I think my shoes are 4 years old. So I guess we'll find out in about 4 years when I get a new pair. Okay, the next one is, it's a little bit confusing here, but it says code carding. And that is where if someone is close to coding and you go ahead and you get prepared, you have everything ready to go, you got the cart sitting out the room and everything, that they won't code. But it also can go the other way. If you get ready, then you're inviting it, is what it says. So either way, you're kind of screwed there, right? Okay, the next one is the last patient, last task jinx. So if you say, okay, I only got one more thing to do and I'm done, or like I got to finish one more patient and I got everything done. As soon as you say that, you're going to get a whole bunch more work coming. Okay, then there's the rule of threes, which, there's a lot of those in all kinds of life. Rules of three, like celebrity deaths and all that kind of stuff. But this one says rule of three is deaths come in threes. And then also different types of patient come in three. Like if you haven't seen like a GI bleed in so long, then you're going to get three of them. You haven't seen like a CBI, you're going to get three of them. I've seen that before. It's like out of nowhere, you start getting the same type of patient. You haven't had a wound vac, you get three. You haven't had a, whatever. So yeah, maybe, I don't know, maybe. Okay, the next one is good room versus bad room. Do you believe that there are bad rooms? It's like, oh, I don't want to get, two or whatever, that you always have a bad time in that room. I don't know about that. Seems like they're all terrible rooms. Okay, the next one is, I've heard of this before, opening a window to let the soul out. If the patient passes, then you're supposed to open the window, let them out, or they get stuck in the hospital, which is terrible. You don't want to get stuck in the hospital. But I don't know. That one sounds a little witchy, kind of like the knot tying the sheet. Just a little witchy. You know what I mean? And who works in a hospital where the window's open? They're all like bolted shut, right? Okay, the next one is the fly of doom. And that is, if you see a fly in a room, then the patient's going to code or something. I've heard about that one before. They say if you see the fly in the room, you're supposed to kill it. And after I heard that, I would always try to get the fly out or whatever. But the hospital I used to work at had a lot of flies. And I always used to joke, how did the fly even get up here? Because, we're on the fourth floor. It would have to take the elevator. Or it's a generational fly. It's parents and parents and, great-great-grandparents. It's like 6th generation fly. And they've, that hospital is their home. Okay, and the next one, Ordering food. Okay, apparently ordering food is supposed to be the ultimate jinx. If that were true, maybe that's why everything's been so terrible at the hospital. Maybe that's why it's always so bad, because ordering food is what we do. The second you get to the hospital, you of course you're going to get report, but then right after that, it's what are we eating? What are we ordering? That's what we do. So if that is the case, nobody's going to stop doing that. Okay, and the last one is the nurse curse. So if you have a patient who is a nurse, and it might not necessarily be the nurse that is the problem, but if you have a patient that's a nurse, you're going to have a rough night. I don't know. And then everybody has heard of like the Q word, and you can't say that, and then the full moon. So those are the ones that everybody's already heard of. Anyway, have you guys heard of these? Are there any that I didn't mention? Do you guys believe in superstitions? I don't believe in superstitions, but I'm not going to do this stuff, if you know what I mean. Like I'm not one to be like, believe in this stuff, but I'm also not going to do it. You know what I mean? All right. Thanks for watching. You guys have a great night. Have a great shift. Have a great night. Thank you. God bless.